Hair transplant. Number of hair grafts extracted versus graft survival rate. If you're a patient and you want the best graft survival rates, how large should your sessions be in terms of grafts? 1,000? This website offers mega sessions, but I'm worried about poor survival. Should I try to get the number of grafts that results in each technician having to deal with the fewest number of grafts possible in order to minimize error? What number of grafts per hair transplant gives the best survival rate?
Thank you for your question. You're asking what is the recommended number of grafts that you should have in a given session, and that you expressed a concern about mega sessions and about survivability. Well, certainly you've asked a question that you'll get a lot of opinions about regarding the best number of grafts to do in a given session. I'll tell you what our approach is in our practice. A little background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been doing hair transplants for many years, and we have in fact developed a non-surgical alternative based on this very challenge of maximizing the yield of a hair transplant, which ultimately is limited by several factors, including graft survivability. The company we developed is called Hair Regeneration, and this was a non-surgical treatment for hair thinning that we developed in our practice. But to get back to this concept, I'll tell you how I make this decision with my patients. First, there is a realistic number of hairs that you can place in a square centimeter. So instead of thinking of large numbers, you can think of the area that you want to get covered. So unfortunately, or the harsh reality is, when you ask a typical male pattern hair loss patient, who frequently comes when they are more advanced with hair loss, we'll discuss the options and recommendations, which tends to be, in my opinion, to put more towards the front and towards the center and less towards the back, because you just don't have enough grafts. But invariably, the patients want the front, the middle, the back, and everything covered. And although you may spread the army out, and from the limitation of the number of grafts you can harvest, you're not going to get density, you're not going to get the volume. So what I do is I'll actually draw squares, and I'll say, okay, this is the number of square centimeters that we want to cover. Now, realistically, technically, in my experience, you can place no more than 20 hairs per square centimeter. Now, there are more than a few hair transplant doctors who claim they can do 75 to 100, which may be true in terms of method, but how much of those hairs will actually survive? I came from a background of eye surgery. I'm very, very good with my hands. I'm a cosmetic surgeon, and I do a lot of very delicate, fine, meticulous surgery. But I can tell you that it's not the placement that's the challenge. It is the health of the tissue that you're placing the grafts in. If you make too many openings in the skin, you compromise the circulation. You compromise the circulation, the grafts cannot survive. We developed, in fact, a system first to try to help the graft survive better using a material called acellular matrix. One of the benefits what we were able to achieve was better graft survivability. Another benefit was improvement of healing in the wound, in the donor area, and we also saw thinning hairs getting thicker. And so we developed hair regeneration, which is a non-surgical treatment that we do separately from hair transplant. Basically, the majority of men and women who come to consider hair transplant as an option have thinning hair. And so what we're able to do is, with this injection, stop the progression of hair loss. We're able to stop, we're able to reactivate the hairs that are not growing, as well as cause hairs that are thinning to shed and thicker hairs to grow in. In fact, non-surgically, we've been able to achieve results which actually exceed one, if not two, hair transplants in the right candidate. So the question that you're asking is also an opportunity, I think, for you to explore other options in addition to hair transplant. Now, the reality is if you are too far along and you have lost a lot of hair, yes, transplant will ultimately get you to where you want to be, but stabilization is very important. If you're able to stabilize and thicken what you've got, then every hair that is salvaged is a hair that doesn't have to be transplanted. I share your concerns, and I would say that being conservative is better because you want to protect the hairs which are in limited supply. I always feel bad if people lose any hair from a hair transplant because of just the limitations of the wound healing. So you never want to overfill, you don't want to overharvest. And so certainly discuss that with prospective hair transplant doctors to understand how many hairs can they put in a square centimeter in your situation. Remember, there are going to be variables such as the thickness of the hair, the quality of the skin, the quality of the hair. This is the finesse and the art of surgery. And asking a hair transplant doctor about what's the best number of grafts is like asking a facelift surgeon what's the best way to do a facelift. You're going to get a lot of different answers. So I hope that was helpful. I wish you the best of luck, and thank you for your question.